Hey guys, welcome to our video chat series here at Focus Hearing, where we answer the most common questions we get asked in the clinic, and we also debunk some of the myths around audiology and the fitting of hearing aids. My name's Kris, and this is my colleague Vale. We're the senior audiologists here at Focus Hearing. We're an independent clinic, which you'll hear more about and what that means throughout this video. So I thought we'd just jump straight into it. And what do you think is the most common question we get asked in the clinic?
Oh, every time. What's the best hearing aid for me?
Yeah, absolutely.
Mm.
Yeah. Do you think that's the right question to ask?
I think there could be a better question to ask.
Yeah. I mean, look, we do get that question a lot. I mean, I've been working in the clinic for 28 years now, and even though technology's changed so much over that time, we still get asked that same question. And I feel personally, the reality is we're an independent clinic, so we've got access to all the major brands and all the major manufacturers. And the reality is they all produce really, really great hearing aids. So really there's not one hearing aid out there that is far superior to all the others. Because when you think about it, when one hearing aid manufacturer has that particular feature, which they'll promote as being wonderful, the other manufacturer will have another feature which they promote as being wonderful, and that manufacturer doesn't have that feature, and so on and so forth. So really, we think that probably the most important question to ask when you're first looking at venturing into improving your hearing is probably, what is the best clinic for me? Which clinic can I go to where I'm going to get the best outcomes? Because I think also, unfortunately, over many years, what we also see is how many people turn up with they're wanting a second opinion or asking us to improve their hearing, and they walk in our door and they've got a wonderful hearing aid. It's brilliant. They've paid a lot of money for it, but is it set up? Is it programmed as optimally as it can be?
Yeah, that's right.
You know, we get that so often, and it's not that it's been done incorrectly, but it's just maybe not have been done as well as it could have been.
Yeah, I guess we've got, we have, because we are so small, we have 3 clinics. We know, and it's us too. We know exactly how we're programming hearing aids, and it is, we do it to best practice, to gold standard, meaning that we take the time to not only program the hearing aid to the hearing test, but to the physical shapes of your ears. And other larger companies may just not have the time to do it, or something like that, but we really make sure it's built into our process. And so we know that you will absolutely have the best programmed hearing aid for you, regardless of what hearing aid it is.
Yeah. I think, and the other important point there, I think, is you and I, we both do exactly the same thing.
Yeah.
We've got very structured protocols that we both work at, and so I know if I'm seeing somebody who you've fitted, I know I don't have to check any of that. It's all been done, and then at their follow-ups, I do what we would both do, and go from there. I think the other thing that we see a lot is when people will say, "Oh, my hearing aid's been programmed to me." It's interesting, isn't it, that we have something in our industry. Every manufacturer will have what we call a first fit in their programming, and so that first fit will take the person's hearing loss and program the hearing aid. Now, in reality, I could have two people, or we will have two people with identical hearing loss. Therefore, their hearing aids are programmed identically because all the first fit looks at is the hearing loss. It doesn't take into account all those other factors that you mentioned, like the shape of the person's ear and how much leakage of sound there is from one person to the next. And therefore, is the hearing aid producing the right amount of sound for the hearing loss? And so that's where working on a very structured program and certainly working to best practices is only going to improve and optimize the fitting when the person walks out our door.
Yeah.
Right.
Yeah.
And that's the thing that I feel most confident of is when a hearing aid wearer comes in and sees us, I know they're walking out of our door and that hearing aid is programmed absolutely optimally the best it can be for them.
Yeah.
Not just on a first fit. Because in reality, how long does it take to do a first fit on a hearing aid?
Yeah.
Yeah. Less than a minute.
Yeah.
You press a button, run a couple of other little things, bang, save, you're done.
Yeah.
How long do we spend on a hearing aid fitting?
Well, we allow 90 minutes for the fitting.
Yeah, hour and a half. Of course, a lot of that is the programming, the tuning, the fine tuning to make sure it's right. It's training them.
Yes. Yeah. And that's the other most important thing. You sort of, we don't just program it, to go to best practices and then say goodbye. We are going, okay, well, these are the things you need to know, and we're with you every step of the way. We're going to have 2 more formal appointments so we can discuss things, and you can let us know the good, the bad, the ugly, and we really work to coach you through, adapting hearing aids to your lifestyle as well. It's not just about the hearing aid itself.
Yeah. And expectations.
Yes. Yeah.
Expectations are massive. We know people are investing a lot of money in their hearing. We know that they're expecting either perfect hearing or near perfect hearing. We know through many, many years of research that a hearing aid will do a certain amount of work. A hearing aid will correct for somebody's hearing loss, but then the brain has to learn how to use those sounds.
That's right.
And I think in reality, that's an area that is significantly overlooked in the clinic because all the value is put on the hearing aid. Here's your hearing aid, it's going to fix your problem.
Yeah.
And if that person then walks out thinking, great, hearing aid's going to fix my problem, I'll wear it when I want, you and I both know that's just simply not going to work. Well, it's not going to work as well as they would like it to, put it that way.
Yeah.
That's certainly the case. It'll do a job, but just not as good as if they've got right expectations. They know that it's going to take time for the brain to learn, to adjust, to learn how to use those sounds that it hasn't heard in many, many years.
Yes.
And I think only with that knowledge that we then pass on to them, we explain to them that things are going to sound strange and unusual. So when they walk out the door and they hear that things being strange and unusual, they go, oh, well, great, that's what I was told it was going to be. Not, oh my God, it sounds strange, it's unusual, they must have done a bad job.
Yeah, that's right.
And we do see that a lot in the clinic, don't we? Where people say, oh, I've never been told that.
Yes, yeah. It's tricky because I'm sure, they've been told, well, these hearing aid features are this. How incredible is that? And
Look
absolutely.
at this brochure. How good does this brochure sound?
And it is incredible, but it is sort of, it's so much more than that. And I often, for those first few weeks, I always say, if you'll indulge me, wear them as much as you can, and you might feel like gosh, for the first week or two, and then, something will click. It may take longer than that, but, it's a process that we're here to guide you through.
And not to mention the fact that we see them a week, 2 weeks after their fitting, and then again 4 weeks after
4
that,
weeks
and
after.
then as many times after that as they need.
Yes.
But the reality is, I think when people are set up with the right expectations, the right training from day one, they don't need multiple appointments afterwards. They can quite comfortably slot into our recommended appointment schedule, which is fitting appointment, 2-week follow-up appointment, 4-week post-fitting, 6-week post-fitting appointment, and then into our 6-monthly preventative care hearing aid clean appointment, and then our annual checkups.
Yeah.
And then, of course, there's the in-between ones that they'll pop in for and have a little bit of help with. But yeah, I find when they are set up well from the beginning, the need for them to come back and with ongoing list of issues is significantly less.
Yeah.
But hey, if there are issues, we're here to help.
Yeah.
So I guess to go back, that's why we would say that probably the better question to ask is, which clinic's going to give me the support to get the very best outcomes? And I think to summarize that, you'd be saying, okay, first and foremost, independent. Independent basically means we're not owned or affiliated with one particular manufacturer or one or two manufacturers. We will look at all the quality systems available and recommend what we think is best for you.
Yeah.
I guess we've touched on it a couple of times. I think the second most important thing is a clinic that follows best practice.
Yeah, absolutely.
Best practice is is not doing first fit. It's going those extra steps to make sure that the hearing aid is set absolutely optimally for that person. And it also involves, best practice also involves the counselling and the expectations. It's not just about the hearing aid programming. The tricky thing though is, how do you know your clinic follows best practice? Anyone can say, I follow best practice, right? It's so that used to be really difficult to look at the audiology landscape and all the options we have with the clinics. And if someone says, oh, well, no, we do best practice or we do everything that's required, how do you know they actually do?
Yeah.
And that used to be really, really tricky. But thankfully now, when did it start? Maybe 12, 18 months ago?
Yeah.
Through the Hearing Up network. So there's a database of clinics and clinicians who have all been vetted and approved to be listed on the Hearing Up Australia network. And you can be therefore absolutely guaranteed that when you are going to one of those clinics for your hearing aid fitting, they're going to be following all the same protocols that we do. And therefore, you will know that when you leave that clinic, your hearing aid's going to be set as well as it can possibly be.
Yeah.
No ifs or buts.
Yeah.
Therefore, if there's any slight issues that you're having, it's not because the hearing aid's been set incorrectly. That's when you'd work back with the clinician. So I think to summarize the summary, it would be, what was that? Independent.
Yeah.
Follows best practice. How do we know you follow best practice? Have a look on the Hearing Up Australia network. You'll get a whole list of clinics around Australia who, again, have been vetted to providing that service for you.
Yeah.